Services Committee meeting. Is there a motion to approve the agenda? Mr. Jeanette, seconded by Ms. Curran. All in favor?
Thank you.
Next, is there a motion to approve the minutes? Curran, seconded by Mr. Perkin. Any discussion? All in favor? Any opposed? Good. Okay, our first resolutions are from Office of the Aging. First resolution is authorizing the chair to sign the 2024 annual update plan. Can I get a motion? Mr. Jeanette, seconded by Mr. Smithers and Perkins and Mr. Perkins. Sorry. Go ahead.
Okay, so this is our annual resolution just for our funding for the upcoming year through the New York State Office for the
Any discussion? Hearing none, all in favor? Any opposed? Carried. Our next resolution is modifying the 2023 budget for the Office of the Aging for additional funding to the expanded in-home services for the elderly program. Mr. Burke, seconded by Mr. Smithers and Mr. Jeanette.
So the next few resolutions that I have will kind of be in that same model of modifying our budget for additional funds. So this is a good thing to happen. Our budget wasn't approved across the state, and ISOPA didn't approve any of the budget. We just got it finally approved in October. So incoming is a little bit more money. So it's a great problem to have. So this specifically is for our home care program. That is for those who are eligible, who do not have Medicaid. They are non-Medicaid folks, and we serve about 60 clients a year in this program.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Carried. Our next resolution is modifying the 2023 budget for the Office for the Aging for additional funding for the community services for the elderly program. Motion by Mr. Smithers, seconded by Mr. Jeanette and Ms. Curran.
Okay, so again, modifying our budget for some additional funding through our community services for the elderly program. It's a very flexible funding source that we use for things such as our personal emergency response and our senior citizen transportation, our medical.
Any discussion? Hearing none, all in favor? Any opposed? Carried. Our next resolution is modifying the 2023 budget for the Office for the Aging for additional funding for the Wellness and Nutrition Program. Motion, Mr. Smithers, seconded by Mr. Tanisha.
Okay, so again, modifying our budget for specifically extra nutrition funding, which was really needed, as you know, this year, and the cost of everything, the food and whatnot. So a little bit of extra funding to help out with that program.
Hearing none, all in favor?
Aye.
Any opposed? Carried. Next, we have a resolution modifying the 2023 budget for the Office for the Aging for additional funding for Older American Act Title III C2 Home Delivered Nutrition Program in the New York State Office for the Aging. Is there a motion? Ms. Curran, seconded by Mr. Tanisha and Mr. Jeanette.
Okay, so this is modifying our budget from additional funding again in our Title C2 program, which is nutrition. So this is specifically for home delivered meals.
Any discussion?
Andrew, in regards to the home delivered meals for next year, are we expanding that service to more households?
We will expand as much as funding allows. We want to serve as many folks as we can.
So in your budget that you gave to our administrator, was there an increase in what you were asking for this program?
Yes, there was. We kind of anticipate based on where we were in this current year and then looking at the upcoming year. So it's difficult to, but we keep ourselves at about knowing for home delivered meals, somewhere between 600 and 700 clients. And then for congregate, about 300 to 400 clients. So we are hopeful to be able to increase, but again, I think it really just depends. We're, looking at what's coming up in the next state budget, hoping for additional allocations because we know that this is a very worthwhile program, but it also costs a lot of money to provide these food services for older adults.
I asked a similar question in our pre-committee meeting, and I commented that there's a push to lobby the state to develop the budget so it is reflective of the growth and population of our older population. next year and in the next decade. I don't know if you want to comment further on that, but that was.
Sure. Yeah, I would love to. Yes, as I said, I think when I presented for our nutrition presentation, the funding is backwards. The most money is coming in from, your county governments, and then your state, and then your federal. So it needs to be switched around, that the most money comes from our federal government down to the states, down to your local governments. Because, sustainability is quite difficult, and thinking about the numbers of older adults, which we know is growing rapidly, specifically in our county. And we know that the needs are very high amongst our older adults. Bulk of the clients we serve are living just above poverty level, so they don't qualify for any entitlement programs, and they're struggling. Our numbers are just through the roof of calls. People accessing food pantries for the first time in their lives. And these are folks, as I say, these are our small farmers. These were our small business owners who put everything they had back into their businesses. And I think now's the time where, our federal and state governments need to be looking at taking care of these folks, because they're the ones who built what we have now. So we've been doing a lot of advocacy through the Office for the Aging, and I would love if anyone would like to talk more about advocacy efforts that all of you could do with our state and federal reps. Please let me know. I'm happy to give you statistics and figures and all the information that you need, because I think while there's a recognition of the influx that is coming, we are not prepared financially. There's not enough money coming into this system to meet the demand, frankly, that's already here, let alone what's coming.
Mr. Tanisha.
Thanks, Mr. Chair. Andre, could you tell us how many folks are on the waiting list for home delivery meals?
Right now, we have about 65 on our wait list, and that is not including areas that we don't even serve.
Can you put a numerical number to that? What said equate? What additional funding would you need for 65 next year?
Well, we'd be looking at staffing, so staffing and vehicles. So probably, I think a number I gave one time in budget is with another 100,000. We could probably start service in a particular area, was thinking of staffing and vehicle mileage and those and extra food costs.
And pick up the 65 total, or?
It depends on what area they're in. This particular group, I believe we have about 20 in one particular area. So I think we could get to them, and then kind of the outliers. Because we can have a route that takes 2 hours each way. Something we can definitely do.
Did you have, okay. Any other discussion on this? Mr. Sperry?
Yes, when we go down to NISAC, and I know Ruth goes, Chairman goes,
Get your mic, sir.
has there been any talk about a plan for increasing the funds for the elderly? Is it just like a few counties that have got this problem with the Office of the Aging population really growing quite fast? Is it just the rural areas, or is it all the counties are facing this?
All of the
So they
counties
must-
are facing this for sure.
So they must be talking about doing something about increasing the funds that comes from on the state level.
Yes, absolutely. There's talk about it.
Yeah.
And I will say the last few years, the Aging Network has received more allocations from the state budget than we have in years. However, we need more federal rolling down into the state. And I think it's a problem across the board in all of the counties. My joke is always New York City seems to be okay. But it is hard, especially for our rural impoverished areas where we don't have the service providers either. That's another really big challenge. Is we could have all the money in the world, but we don't have any providers for the services. That's another gap in the services. The governor's office has the master plan on aging that they're doing. However, that's not due until 2024. And I think those of us in the Aging Network said, we already have the data. We know where the gaps are. A 2-year study doesn't help get our services now. And that's really what we need. We've seen this coming for years. And I think a lot more preparation needed to, happen at the state and federal level to help us be ready to serve all of these folks. And we are through the Association on Aging New York. It's our advocacy organization. And that group is doing a ton of work. I'm a board member with them, and we do regular outreach on this topic. And our executive director testifies for the Senate and the Assembly every year, requesting a lot more money.
Is this board sent, if I may, has this board sent any resolutions to the people on the federal level asking for an increase in funding and explaining why, and maybe the state level as well?
I honestly am trying to remember if we just did one not that long ago to the state. So yeah, we can check on that and certainly put one forward to federal government as well.
Probably do that.
Yeah, absolutely.
Just an observation. We got, the United States spends hundreds of millions of dollars on asylum seekers, and hundreds of millions of dollars on humanitarian aid, hundreds of millions of dollars on foreign aid to oftentimes to countries that don't even like us. But yet we have a growing population of elderly in the nation that we can't find enough money to take care of our own. It just seems very abstract.
Backwards. Any other discussion, Mr. Jeanette?
Just wanted to piggyback off, for instead of millions, we're in the billions, what we've been giving out lately, so, yeah, and it doesn't seem like.
Any other discussion? Okay.
Just a comment, we should also improve. And then doing that is just gonna snowball into the food. Thank you.
Any other discussion? All in favor? Oh, sorry, Mr. Burke, you got in.
I'm just curious, is there capacity in any of the geographies?
Yeah, absolutely. We do have runs that we can expand. We're always looking for volunteers to start runs and things like that. So, this number fluctuates. We try to get it down as quickly as possible. We also make sure that anyone on the wait list does have access to food. It's just they might not get the home delivered meal Monday through Friday, but they are offered the opportunity to pick up frozen meals or have a family member pick up for them, as well as other mail food order programs. They're actually good. We've gotten samples of them. It doesn't replace certainly the hot meal, and it doesn't replace the wellness check that we do, which is another critical component. But we do try to get to them as quickly as we can.
So the 65 is for the hot meal and the wellness.
Yes.
Thank you.
Mary, how many volunteers do we have over the course of the year in
Sure.
the food program?
Sure. We have about 100 per week. Which is amazing. We wouldn't be able to serve. We have 26 home delivered meal routes and 5 congregate dining sites open, and without the support of, it's a lot of help from the Archdiocese St. Lawrence and United Helpers, which is a really wonderful partnership between their participants and staff come and deliver our meals for us. Our clients absolutely love it. They form relationships as well as community members as well.
Not seeing any further discussion. All in favor of the resolution?
Aye.
Any opposed? Carried. Lastly, for Office for the Aging, the last budget mod for here. Modifying the 2023 budget for the Office for the Aging for additional personal care revenue from cost share clients. Is there a motion? Current second, clerk.
Again, modifying the budget for some additional revenue with our ISEP program, which is our home care program. For some clients, there is a cost share depending on where their income levels are. If they're 185% above the federal poverty levels. So it's a small amount of money, but it's their contribution to their care.
Any discussion? Hearing none, all in favor? Any opposed?
Thank you very much.
I neglected to note this at the beginning of the meeting, but Legislator Criminelli is excused from. Next, we have public health. Zimmerman, hello. Our first resolution is authorizing the chair to sign contracts for early intervention services for the Public Health Department and setting the 2024 rates for early intervention services. Is there a motion? Mr. Forsyth, seconded by Ms. Curran. Okay.
Mr. Chair. So this resolution, we're just looking to set rates for 2024. These rates are set by New York State and it's all the same rates as they were. No change.
Any discussion? Seeing none, all in favor? Any opposed? Next is a resolution authorizing the chair to sign contracts with veterinarians and assistants for rabies clinics. Mr. Smith, seconded by Mr. Forsyth, and Ms. Curran.
So this resolution, we're just looking to be able to pay our veterinarians that come out and help us with the rabies clinic as well as their techs. We host at least 2 vaccination clinics for rabies in the county each year. And I did look up some numbers in case anyone was curious about how many we were able to provide this past year. We gave 1,249 rabies vaccines to dogs, 529 to cats, and 5 to other animals, which typically were ferrets in 2023.
Any discussion? Mr. Forsyth.
Yeah, thank you, Mr. Chair. You Tractor Supply, I see that they have like veterinarian services. Do they do rabies also?
I believe they do. I think their times are a little bit limited. Like,
They do? Okay, yeah, I was just curious. I just. Thank you.
Any further discussion? All in favor? Any opposed? Last, we have a resolution modifying the 2023 public health with the early intervention.
So this one is the budget modification. We did have a little bit higher than anticipated expenses just with the early intervention program. Our caseloads have been higher, about 180 versus which is normally for us about 140. And we've been seeing more services per child. It used to be there was really only one service on a child meeting, but we're just seeing much more complex cases. And there's also been many more parents that are driving to receive services. So they're driving up to Ogdensburg or Canton, and we cover those transportation costs as well. So that's kind of where those higher costs come from.
Any discussion? Mr. Lightfoot.
Just a question. What is the 22.5 coming from pre-K? What does that leave the balance in pre-K coming up on the end of the year?
I don't have that number off the top of my head for what we have with us, but I can certainly.
You know whether or not you anticipated a surplus in it, or we're going to be in red?
We're not expecting to move the 22,500. We're not expecting that to be an issue for the budget.
Any further discussion? Mr. Burke.
Reimbursement.
So for EI, I don't believe that's a reimbursable expense. Well, there's some reimbursement for Medicaid for services that are provided, but that's more in the school setting. Both for administration as well as like organization.
Any holiday? Any comment? Next, we have cleaning services. All right. No? Hey, you look so different. Yes.
at addiction services relatively stayed the same, as well as the mental health service visits for 7 hours. Face-to-face for the addiction side did go up a little bit, as well as the mental health side. Looking at the rest, the second page, the prescriber visits, those stayed the same as well. The waiting list, a note on the waiting list, everyone that is on the waiting list for addiction services or the OTP does have an appointment with a counselor. With the waiting list is waiting for an appointment with a provider. So we are at least providing counseling services or peer services to those individuals that are waiting. The percentage of dollars paid of bills, that continues to kind of be up and down, but we are seeing some growth there with that chart. And then the dollars paid versus dollars billed, we are continuing to see monies trickling in over the course. We do have 2 medical billers on staff now, which has been wonderful. Both of them do have experience in billing. So we're working a lot on getting the credentialing fixed across all of our payers, as well as working on the denials that we have. So we are seeing some positives there with the 2 folks doing the billing. Promising, I should say. And then no change for the OTP admissions and discharge. We stayed pretty flat around the 170 for folks entering or receiving services from the OTP. Just an update on our OTP credentialing. So unfortunately, with the leaving of our administrative services manager, we discovered that our Medicare application was not filled out correctly. So because we use the federal tax ID for the county, doing business as was listed as St. Lawrence County, when realistically it should have been St. Lawrence County first, and then doing business as St. Lawrence County Community Services or St. Lawrence County Addiction Services. Additionally, because all of our licenses don't line up, so we are licensed by the DEA, we have the CARF accreditation, as well as we have our certificate from the New York State Office of Addiction Services and Supports. All of those names are not the same. So we're running into issues there as well. So for OASIS, where our certificate is under St. Lawrence County Community Service Support. For CARF, we're under St. Lawrence County Addiction Services. For the DEA, we're under St. Lawrence County Addiction Services, but our federal tax ID is St. Lawrence County. So we're trying to get the state agencies to align all of these, and it's been a struggle. Additionally, on the Medicare application, we discovered there's a section where anyone is going to have somewhat liability for dispensing medications or touching medications in the OTP. So any nurse, medical provider, any director that has oversight of the OTP has to have a specific section completed. That wasn't done on the initial application. I've been trying to reach out to the contact at NGS, have left messages, emails. We had one initial contact, and I haven't been able to get in touch with that individual since. So it's been a struggle. It's been frustrating, but know that we are diligently working on this. At the same time, we're also trying to get Fidelis to be accountable because we've been told by the state that Fidelis should be reimbursing for the bundle code. So if you guys remember, there was always this whether we do bundle or we do APGs. We've been told by the state that Fidelis should be honoring those bundle codes, which if that's the case, we should be able to recoup, everything that they haven't been honoring. So our new medical biller has a good contact at Fidelis that she's worked with. So we're leveraging that relationship as well to see if we can have some headway on that and get that straightened out.
Mr. Burke first.
Lindsay, are we still billing like say $180 or knowing that. Have we adjusted our billing to adequately reflect what the entity is gonna pay?
Yes, we have.
Yeah.
Yes, we have changed, I think that we call them customary and contractual charges in our graphs. In our weekly billing report, and yes, we have aligned those to be more realistic, so the write-off isn't so large.
And is Medicare still a small part of our service?
Yeah. We're still getting reimbursement on the mental health side for Medicare. It's the addiction side isn't, we're not able to bill Medicare yet. They don't reimburse. That is coming in 2024. What we're looking at is just the OTP clients that have Medicare that we are reimbursing for. And a lot of them do have secondary insurance that we're making sure we're trying to collect or get them signed up for Medicaid. So we can collect some or recoup some. But it's a very, very small percentage. I think the last time we had looked it up, I want to say it was 10 folks enrolled in the OTP that had Medicare.
One more question, is the
With the new medical billers, we're noticing some more glitches, and myself and one of the program directors, anytime one comes in, we're actively fixing it. So we are working on that back end of setup as well.
There.
Thank you, Mr. Chair. Ms. Best, the going after getting this straightened out, that's landed in your lap?
Mine and Jay and I are working on it together. Yeah.
Okay. Well, I have no doubt. The two of you on that.
It is. Yeah, it would be nice to have the administrative service position filled.
Yes.
Without a doubt.
Thank you.
Mr. Reagan.
Have you reached out to, our representatives in state government to ask them to have the agencies, respond and address these problems?
No, not anyone in state government,
Because we're talking about Oasis.
no. Yeah, we talked to Oasis.
I know, but what I'm saying is, we have state legislators who have, when they call the agency on behalf of you, they have direct liaisons with the agency whose job it is to kick the problem to someone who can solve it. And then report back to the state legislator whether or not they've solved it. And a lot of times you can get your issue moved higher into on the pile if the agency is aware that there's a state legislator who is saying, you come to me at budget time and ask for money, I'm asking you to address this problem. Can you do that? So, you know, rather than keep knocking your head against the wall with these people, because I know I used to do this for a living. I would strongly suggest that you talk to Senator Stex, you know, talk to Mark Walczyk, talk to Scott Gray, talk to Ken Blankenbush, put them on it and get them on it and have Congresswoman Stefanik's office get on DEA. You know, you've got these representatives, they've got staff, that's their job, put them to work.
Free political advice from Mr. Reagan. Mr. Lake.
Thanks for coming, Lindsay.
You're welcome.
Appreciate it.
Absolutely.
Lindsay, some of the information that I've seen shows that, or appears that we're billing for contractual services. And we're also billing for customary services, as you mentioned. Can you tell me what the difference is in that, and tell me whether or not we are actually billing twice for the same service under two different, customary and contractual categories?
So it's not, we're not billing twice. So what the difference is an APG rate, which is set by the state of, for insurance, what you could reimburse for a particular service. There's CPT codes for each procedure that's done. And what you can do is you can do the APG rate, but then you can also bill an inflated rate, right? So historically, we've always done that inflated rate. So what we've done is align those contractual and the customary to be the same thing, to be that APG rate. So that's what we're billing out one time initially for a service. If we get a denial, then we'll fix, what needs to be fixed and then bill out for that particular service again. So we're not we're not doing two bills at the same time for one service.
Okay.
That makes sense.
So from October of 2022 to October of 2023, it shows, from what I've seen, billing under both. And apparently, the recipient of the bills that we send out have sort of caught on, because if you look at the amount that the customary pays for the year period, it's almost exactly what the contractual.
So,
Here, I guess where I'm getting at is, why do we continue to do this? It doesn't a waste of time to be using two different billing methods, for lack of a better word, and getting a no, you're not going to get this. And I can't tell from the figures that I've seen whether or not this is a rebill or not, but I'm assuming based on what you said, there's a lot of rebills. It seems like a waste of time to me if you take a look at that 1 year period from October to this past October, the amounts are about the same. So why would we waste our time doing that? And doesn't it create a lot of problems in the long run, because you've billed it once, now you got to rebuild it again?
So it wouldn't necessarily, if there wasn't anything wrong with that initial bill, we wouldn't have to rebill it. What would happen is you would see a higher percentage in the write-off column. That's what we wanted to get rid of, is that high percentage in the write-off that we were causing ourselves by billing an inflated rate, that we knew that we were only going to get reimbursed the APG rate.
And that's my point.
Yeah.
If we know that we're going to get struck by lightning, why do we continue to stand there and get struck by lightning?
We changed that to align with the APGs and no longer have those crazy write-offs.
Okay, so when did we stop doing that?
It would have been, just this year, I'm going to say, I want to say it was summer, late summer, early fall, if I remember correctly. But we can look exactly for the month.
I think if you check that until October, and I haven't seen anything since, that in a continuous thing from October to October, September to. So, one last question.
Yes, sir.
What effect has this had on your billing? Not only the extra work involved, correcting things, responding to failure to pay. What effect does this have? Has it increased your workload? Has it made a mess out of things? Because if I were looking at this, and I certainly don't have any expertise in billing, but it seems to me that it's a mess.
So what it's done is increase the write-off percentage, so it looks like we have, it looks like we're not getting paid what we should be. So I think, for one, it's done that, it's painted not a very good picture of reimbursement rates for us with billing these inflated charges. I don't think it's increased workload for our billers. I think what has happened is it's made it very, very hard to actually see what we're getting reimbursed. If we're getting reimbursed the full APGs, I think if anything, that's what it's done. But I don't think, billing, an inflated rate has produced more denials. If I'm being honest, I think the majority of our denials are coming from credentialing issues, our staff not being credentialed properly with all of our payers. Those are the trends that I'm seeing now and working with the billing staff. We do have one of our medical billers has credentialing experience, so we put her on that task. We're working at that. So I don't think that the customary or the contractual is leading to more work.
On this topic, but just from my limited experience with clinical billing, when we bill or any clinic bills for a medical service, the insurance, the payer, the insurance company, when they receive that claim, the dollar amount is almost the least important thing on the page. They're looking at the clinical code, whether it's ICD or the DRG or the APG or the J. They care what is the code, what is the service that you provided, and then they look at the provider. Is that physician or NP credentialed with us? Then they look at the documentation. Is the proper documentation provided if it's necessary? So they have a few layers that they're looking through. And then at the end of that analysis, they either say, all right, we're going to pay this based on our own actuarial tables or contracts with the entity that's billing us. Or they say, we're going to deny this with a denial code that should tell us what they want, but it often doesn't. And so that starts the rebilling process. So I've never seen a situation where an insurance payer will deny a claim for medical services because the dollar amount was too high. They don't really, it doesn't seem like they care. It's in our benefit to hit the nail on the head though when we're sending that bill out, because that dollar amount feeds into our expected reimbursement or our expected revenue total from an accounting standpoint. And so it helps, I think what you're getting, it helps us to have an expectation consistent through the system. But it doesn't, I don't think it, from what I've seen, I haven't looked at all of our charts, but just in other areas, it doesn't lead to otherwise, it doesn't lead to denials that otherwise would be avoided. Do you want to follow up on that?
No, I'd like to comment on it, and then I lied to you. I've got one more question.
You can blame me for it, yeah.
All right. The other question is, we've got other programs that we build for in community services. You got the OTP, and you've got another one, AS or SA, which is
Addiction services.
addiction services. So do we bill the same way for them, or is it just with the mental health side of things that we bill customary and contractual?
No, it was across the board that we were billing those inflated rates, and that's what we changed across the board for all of it.
So just a novice looking at that, and I don't have a crystal ball to look back or look forward. If you're billing initially for an inflated customary charge, historically, they're not paying you that. And the difference for that period was what, approximately $1 million that you billed for, that under the customary program that they cut back because of, however they do the calculus, right? Okay. So I think that's something that really needs to be addressed big time. And you see you have a new biller. Can you tell us a little bit about that person? What experience they have, and is it in governmental lingo that they're experienced in it, or is it in hospital, or does it really make a difference?
So, they were an office manager for a doctor's office, so they did, the credentialing, the billing, the financials, for that doctor. So, they have experience in all of the credentialing portals that we have. They have, experience, with CPT codes. Do they have specific behavioral health, billing experience? No. But what I'm finding is if have any experience doing medical billing, you can pick up the lingo, and understand it. So, you know, I think the credentialing piece for us is definitely going to be huge. Because everyone, needs to be credentialed with every payer. And sometimes the denial could be, you know, we didn't have that particular counselor or therapist credentialed with that provider, and that's why we weren't getting.
Thank you, and thank you, Lindsay.
We got a line from Mr. Burke. Did you still have a comment? Get your hand up.
Just a quick question on the bundled services we've been in state says we should get. Are we under the same 90-day? I mean, when they don't pay when they should, if it goes beyond 90 days, is that a loss?
We're billing unbundled, so we're billing separate services, so we are getting reimbursed for those. It would just be much easier to bill bundled.
And aren't bundles higher or no?
It depends on the CPT code and the reimbursement. I don't know off the top of my head, specific to, so bundled is specific to the OTP. So off the top of my head, I don't know the difference between the two.
Thank you.
Next, we have Mr. Forsythe, and then.
Thank you, Mr. Chair. Lindsay and Ruth, I guess this is for both of you. So 2024, just looking at the 2024 tentative budget, before we turn the lights on, county cost is $1,040,000, right? Before we even start the billing process, it's gonna be a county cost of $1,040,000.
Revenues counted in.
How did we, I noticed that the revenue expectation is 639,000 higher than last year, or up 6.95%. What's your comfort level with that number? I mean, how do we come to that?
I mean, there's been vacant positions, positions.
I'm talking about.
Well, I mean, I think we're hopeful that our billing is going to be straightened around, to where we're going to see the benefits, or the reimbursements from the OTP.
So based on your anticipated revenues, is this a projection of your hopefulness of 100% billing or 92% billing?
Whatever the average is, I mean, I would love to see an increase, what we are right now, I think in the 40s, 50s, up to
Right.
at least 70s, 80s.
So is this 9.8 million based on 40s or 50s, or are we hoping for that? I guess that's where I'm at. How realistic is 9.85 million?
So we also have a grant in there as well, the COSAP grant.
Yeah,
Yes.
Which is just in the OTP at 195,000.
okay,
And it also has full expectation in the OTP clinic revenue of an additional roughly 180,000.
so there's 370.
So that's just about half. The
Okay.
increase is specific to the OTP. Now, COSAP revenue is also spread, I think, in addictions.
Yes.
As well. So there's an expectation of full COSAP one. I think we got an extension for 1 year. We have to get what's left over and what we included for that, but the balance of the new grant as well as.
And I didn't mean to skip and move the budget. I know you're gonna cover this later, but as long as we were getting into the billing and all this other stuff, I think it's relevant that, before we turn lights on, we're just, right? And then we're hopeful of 9.85.
So there's a reduction in addiction services. significant revenue. There's an addition in Canton of increased revenue.
Which, we had moved the two counselors from Governor.
All right, I just, when I'm thinking of how you derive this budget after what I just listened to.
And typically the revenue is trended, you have to go back and look at our notes, but typically the revenue is trended on the averages of what we're seeing come in. And
Okay,
you're looking at billing, don't just say this many people times this many units of service, because we may not have providers, we look at our trends of actuals that have come in and trend that out. More realistic than saying, if we saw, and then we got, we would get, and then we got fully reimbursed.
thank you.
Senator Hager?
I have a question because I don't understand, this credentialing thing. You need to comment. It's being raised so that, when you bill for them, they're raised.
No, so every counselor or therapist, prescriber has what's called an NPI number. So, sometimes it's billed under the clinic, sometimes it's billed under the individual. But we have to have each of those separate NPI numbers registered, I guess is the easiest way to say it, registered with the insurance.
Gotcha. That, I understand. Thank you very much.
Mr. Smith?
Your explanation has been sort of helpful, I think. Because we talked about overbilling and stuff. I guess then my question would be on these denials. And denials again and the resolution. What would you say about the eventual resolution of the denials? What percent of the denials are eventually resolved? And it's probably not going to be 100%, that'd be unrealistic, but where does that fall? I mean, and then I have another question. It's not about billing.
You know, I would love to see us, 95% of the denials resolved. If it's a credentialing issue, if we're able to decipher the denial code, those are certainly much easier. The ones that, we probably wouldn't be able to resolve would be the timely ones. So, out of the window to be able to bill. But if it's a fixable issue, we should be able to fix it.
So that didn't really answer my question.
So if percentage, without knowing, what the percentage breakdown of each denial is,
It's just, okay, the other question I have isn't about billing, but I don't know if we're ready for that.
Go for it, yeah.
Okay,
Well,
and you mentioned just briefly this in one of your responses about changes in the facility at Governor, and I was made aware of that today. And you mentioned before the meeting about changes in the facility at Messina. Could you just elaborate or explain a little bit about those changes and the consequences that those changes will bring about as far as the services that are rendered?
So I think everyone is aware, we had closed our Messina location, which is a satellite off of Ogdensburg, which is a satellite off of Canton. This, I believe, has been talked about for a while to reduce cost to the department. When telehealth really started, it really doesn't matter where the clinician is, they can treat an individual wherever they happen to be. We've often said, it would be nice if we didn't have separate PRUs, what they're called for Canton and Ogdensburg, and it was all just addiction services under Canton would be ideal, but unfortunately Oasis doesn't do that. So what we've done with the closing of those two satellite locations, our mobile clinic has dispatched those areas. So if an individual does want to be seen in person in Governor, the mobile clinic is there 1 day a week. They do also have the opportunity to come to the Canton location, Ogdensburg location. If they have Medicaid, we can help them arrange Medicaid transportation. In Messina, our mobile clinic is there 2 days a week, and we also have one of our counselors that shares some office space and probation to be able to see some of the probation folks face to face as well. So there really hasn't been a huge disruption in services that we've seen or heard or our clients are reporting to us.
Great.
Back to the Fidelis. We were saying that Fidelis basically. You should also enlist those state representatives that we were talking about to sit them on Fidelis as well, because usually they may have a contact person with Fidelis, and Fidelis comes and lobbies them. And, you know, that's what they're for, is, and they can say, why are you ignoring St. Louis County's requests in order to just get somebody higher up in the food chain looking at the issue. So.
Any other discussion? Mr. Lightfoot.
One question.
I'll hold to it. I understand.
Are we able to successfully respond to cases in our billing where it's been refused within that 90-day time period? Or are we writing off, full amounts billed because we've exceeded that time period?
No, we're able to address them in that time period. The billers spend a couple days doing denials. So the week is broken out between doing the normal clinic billing, but also working the denial. So each day they have set to work regular billing and denial. So
This isn't another question, but how many people,
Mr. Light?
Sounds like.
how many people do you have doing the billing?
two people actually doing the billing, and then we have an account clerk who posts all the payments over. So I would say we have 3 working.
Thank you very much. I apologize.
Any other discussion or questions? Lindsay, you mentioned there's a service that's going to be reimbursable in 2024, but isn't currently. What I was writing notes. What is that service?
So the addiction services currently right now, you can't bill Medicare for those services.
Just for Medicare.
Just for Medicare, yeah. So coming, it'll be able to bill for like some services.
Well, we have not incorporated that additional expectation to our budget for next year, right?
I don't believe we have.
Okay.
Yeah.
So that would be a.
Yeah.
Okay. All right. Also on the presentation. Yep. Thank you so much. Next we have, I have to check to make sure it's the right person. Coming up, you never know, with social services statistics, eligibility. Evening, sir. Yes, sir.
Good evening, everybody. Sorry, we have a little bit hoarse tonight. I know the agenda says we're gonna cover really review. Deputy Hamilton and I. What I'm going to do is give you an overview of everything we're doing right now, but I will respect the request I was already given this evening to debrief and try not to put anybody to sleep tonight. So, but I do have, as we're going through this, I do have some announcements, like highlight. Yes. Yeah, some highlights of some things that are going on, and I will be referring to the additional handout that you all have on your desks as well as we go through. So, we'll start on the first page of our statistics. The number of note that I'd like to bring up that I think is going to be kind of a driving force through the majority of the services statistics right now is that in October we had 205 referrals, which is incredibly high. That is the highest number in a month that we've had come in for child protective services since I've been here. That's caused some issues for us, and as we're going to get to that as we go farther down to the statistics. I don't know why October's stats were so high. I do know at my meeting with the other commissioners, in the North Country region, there are 7 counties plus the reservation. We are all experiencing the same thing, so it seems to be kind of a society-wide thing right now. But October for us was crazy. It was very busy. You know, we normally, our average month was 171 referrals, and again, we beat that by over 30. And that was a big lift for our staff. So, safety checks were at 98%. Again, we always strive for that 100%. There's a lot of reasons why we could miss those 2%. It could be, you know, trying to reach a family member that's on vacation out of state or whatever. I'm not sure why we missed those 2, but I will say, you know, it went from 96 in August to 126 in September. And I don't have the October stats yet, but it's going to be a lot higher than that. So, moving on to page 2, the number of reports that we got in August really kind of hit us in the caseload. We went from our 13 average, where we've been trying to hold on to with some of the turnover, and it bumped us up to 50. So we haven't gone over the OCFS recommendation, but we're right there. And that is directly as a result of the number of cases that we had come in, you know, extraordinarily high number of cases. We have, as we'll see later on, our training pool is full. We've had a number of vacancies. We're ready to move some of those people into those slots. But as you've all been told before, it takes quite a while for somebody to get completely trained and then to be able to handle a full caseload. So we're going to have a couple of bumpy months still until we get some of these people cycled through, but we're starting to see that happening. We're bringing more people on, trying to stem the flow a little bit. But I do see better days ahead. Our total caseload was a lot higher. You know, our total caseload of 394 cases. We had added 211 and closed 116. And normally in a month when we close 116 cases, yeah, we're doing well. This month with the additional cases would put us behind the 8 ball. So if we move on to the next page, to page 3, in the foster care, you know, we were very close prior to this surge in October. We were very close to having our youth in care numbers down to a point where we haven't been since the 1990s, under 200. We ended up at the end of October at 214. Now, I will say that between that last piece of October and that first week of November, we had a number more adoptions come through. So we had some more kids come out of care. We're continuing to push that through. I'll mention that, you know, when we talk about it. But we, you know, we added 12 kids to care and only took out 9. So I mean that doesn't move us in the right direction. Without that surge in referrals that we've had and all the caseloads we've had going on, and where kids have been taken to care, I think we'd be, you know, seeing numbers that are even lower. But if you look down at the bottom left chart, 2023 so far, our average number of children in care at 220 is much lower than it's been in any year in recent years. So we're moving in the right direction, and we're really taking pride in that. We're working on getting kids to permanency, either back with their homes or with the adopted family that they need to be at, and get them out of the limbo of being foster care. On the next page, page 4, some good news here. Our average caseload in foster care, because we're getting these kids out of care, actually dropped from 10 to 9. So that's good. The people in foster care are doing a great job moving these cases on through the adoptions unit, whatever unit we got to care. So this gives me the opportunity to maybe do some additional training with the foster care people, but also I do plan on repurposing one of those caseworker positions to move over to the adult protective and homeless unit, and I'll get to that again in a minute. I think we're going to see, as you will see some of the numbers, doing some great work over there. I do need some additional assistance. Moving on to page 5, adoption activity. We had 7 adoptions in October. Again, we could have had a lot more, but some of them we just couldn't get them through by that October 31st deadline, so they all came in that first week of November. So I don't have the exact number there, but I think we're going to have some good stats all of the month to show, because I know I've signed off on a number of adoptions recently to get those back. Towards the bottom, looking at visitation, we've been trying to, you know, to get our money's worth from our youth advocate program contracts or YAP contracts, so the number of hours, and the number of visits are both up. So that's good. We're getting that done and making sure that we have excuse me, the visits done that we are required to do. Well, page 6 talks about homeless places, and I'm gonna flop back and forth between this chart, this additional one here that you all have on your desks. I'm very proud of some of the work that we've done. If you take a look at the homeless placement chart, this time in October last year, we had 61 placed in hotels. This October, we only had 38, even though we all know that the number of homeless people out there is up. Part of that is because we have the homeless services unit. And I have some statistics for you on this other handout that we got together too late to add into this chart. I'm trying to have that put in there to go on. Yeah, you all had asked for some additional statistics at the last meeting about the unduplicated number of people who've been placed in shelters. This is from one calendar year, from October 1st of last year to September 30th of this year. They're still working on getting all of the stats for October collated and put together. But we had 217 distinct individuals receiving services, some of them probably more than once, but you asked for the breakdown of the number of individuals. So we had 217 individuals and 34 families for a total of 328 people that we placed in hotels and shelters last year. What I'm very proud of is the chart below that. Unduplicated number of individuals that are placed in permanent housing by that homeless services unit. We've been doing an outstanding job. We have 116 distinct individuals and 39 families totaling 259 people that we were able to move to permanency. Now, these statistics show the last 3 months of last year where we didn't have a homeless services unit. So the majority of these numbers come from January 1st of this year. I have, and I'd like to call them out by name, Ellen Hayes and Shannon Kenny as my examiners working in the homeless unit tirelessly. And Bob Pike is my caseworker who's out there beating the streets every single day, going to these hotels in the morning, meeting with the people we've got in shelters, getting their applications done and helping them get moved into a permanent housing. They've been doing an outstanding job. And the last is the length of the shelter stay in days. So the vast majority of people are staying between 0 and 30 days, 222 individuals, 25 families. I'm sorry, 222 individuals stayed 0 to 30 days, 25 of them were 31 to 90 days, and only one stayed between 90 and 180 days in shelters. Families, we had 28 families stayed from 0 to 30 days, only 6 stayed from 31 to 90 days, and then we had them where they needed to be or they found another alternative. And we had 321 people. I don't have the colors. So we had 312 people total, 0 to 30, 45 total people, 31 days to 90 days. Only one person again. So I don't have the exact numbers from the previous year, but I can say that I know anecdotally that there were individuals that used to ride out more than 180 days, playing a hotel game, going, showing up because they didn't have any place else to go. The other thing that we're working on here to tie into this, and I'm very, very pleased, and we'll have a resolution before the finance committee this week to discuss it, is, as you all know, a couple weeks ago, Chief Kearns and Ogdensburg held a meeting for community stakeholders to talk about what's going on in town. And part of that, they talked about the homeless issue that's going on. I attended that meeting, as did Mr. Lightfoot, and listened to their concerns. And the following week, I met with the people at Step by Step who have converted the Lincoln School out there into some housing for the homeless. We've been working on a warming center for some time, had the funding approved, and we're ready to roll with the Salvation Army, with their issues that they've got going on right now. They backed out on us, which left us hanging. We were able to very quickly meet with Step by Step and put together a program. And I'm very pleased to say that they are allowing people in as a warming center right now if they need to be. But they will be having a grand opening, with our funding as first week, our plan, December. I'll have that contract in front of you, resolution, next week, for finance. This is a program that I'm extremely proud of, because I think that we're spearheading something in the state that's not being done, because what we're doing in the program I'm putting together, and my deputy Hamilton has been putting together, and all of our staff are working on tirelessly with these people. It's not only provide funding for the warming center, but in doing so, that funding is gonna go towards the residents, some of the residents that stay there, and have them man the warming center. So not only is it providing a warming center for people, it's also providing some additional income for some people who desperately. So I'm very pleased and very proud of this program. I've been talking it up with the commissioners meetings. And it seems to be something that is kind of a model program. Very, very proud. So anyway, I got a little bit off topic, so that I went back on my promise to be brief. I'll get back on topic now.
While we're on, before the homeless, yeah, sorry, I had a comment.
Sir.
Thank you. Commissioner, I just want to personally thank you. I think that the fact that your homeless task force has worked with 328 individuals is a major accomplishment. 217 individuals, 34 families. I think this is a major accomplishment. I think the public at large has this impression that the county and social services is ignoring the homeless problem. And I think that we need to stress out there that since January, people from your agency have placed 328 individuals into shelters, and 259 have ended up in permanent housing. And more importantly, I think it's important for people to understand that it's not just a matter of putting them in a shelter or putting them into permanent housing. It's a matter of putting them into services, whether it's addiction treatment, whether it's mental health, whether it's a whole gamut of the services that your agency provides, that county government provides, that community services provides, and all of the network of human services agencies that the county offers. Most people in the county have no idea what county government does. And the average person says, but I've had elected officials say to me, what's the county done lately? Well, you're doing a lot. And, it's important for the public to understand that these individuals who are homeless often have a whole myriad of issues, which is why they're homeless. They have addiction problems. They have mental health problems. They have all sorts of reasons why they are in the situation that they're in. And it requires more than just putting them into a place for the night to help them address their problem. And it may take more than once, because a lot of these people are their own worst enemy and, have to have help over and over again until they finally can get some sort of stability in their life. And I cannot stress it enough that we need to make the case to the public that this is an issue that this board has been very, very concerned about, and that you as commissioner and your staff have stepped up, working with community services, working with the Office of the Aging, working with Step by Step and a whole gamut of other agencies around the county to try as best we can to address this very real problem that is concerning and upsetting the people across the county who think nothing's being done, but something is being done. And, you know, I applaud your efforts, and I hope we do a adequate job of educating the public that we're not just sitting back allowing this problem to get worse and worse and worse.
Thank you, sir. I appreciate it.
Mr. Burke.
No. Top of page 4, as our numbers go down. I guess I'm wondering what the breakdown between aftercare and before we what is the breakdown? I understand it. Maybe it's wrong. There's more money to contract. Those. And I have another.
Total breakdown here, do I? Yeah, I don't have the breakdown with me, sir, but I can get you those numbers. I did meet with, Tang on the record children's this week. Reviewing our contracts, to make sure that what we're doing makes sense for not only for their department, but for our county as well. To do some planning in the future. There are a couple, I'm doing that. I am actually looking at all of our contracts, not just the children's home. There are some contracts that I will not be bringing to you to renew come January 1st because we can do it more cost effectively ourselves. I think a lot of the things that we do, those contracts were great at the time we needed them. There was times when we were in a different staffing situation before you gave us the extra positions. There were times when the economic situation was different. Both for us and for the agencies at large. And I think just maintaining the status quo isn't going to get us where we need to be. So we're taking a look at those contracts. There are some that are going to be coming here. And one of the ones that I am looking at is our relationship with them in terms of foster care and how much they're doing and how much we're doing. And some things, maybe they can serve us better in other areas than where we are now. So I will get that breakdown for you, sir, but it is something that we're looking at very closely because I want to make sure that cost-wise, we're doing the most that we can for the bucks that we've got.
Well, one of the reasons I asked that question is that you plan to reassign one of the staff away from this. I guess in the back of my mind, could that staff ever be used to the children's home? It may not be that simple.
Yes, it's not that simple.
So I guess that's the nature of my question. I hate to see the taxpayers pay more for services than what we charge for the services.
I agree, and that's the impetus, really to start looking at some of this. I think Dr. Taylor feels the same way. They're looking at changing their business model. So I do believe that our relationships will be changing drastically, possibly in the near future. I don't have any concrete information. Something that we're looking at, and we are going to make sure that to the best of our ability, that we'll be doing the most we can on our side, contracting them as little as we can.
One last question. Children referrals for child protection way up. Is there anything that you can say to help us understand what's occurring in the?
So I've asked our co-location staff to get me some numbers. I'm still waiting on a breakdown of that to see exactly if there, what the increase was, in terms of dealing with the referrals that are substance abuse related. But anecdotally, I can say that the number of referrals that we get involving severe substance abuse on the part of the parents or people involved in the cases is greatly increased. And it's statewide. Every commissioner, we're all feeling the same thing, experiencing the same thing right now, and we're trying to find a way around it. I don't know what the answer is societally to how do we get around it. You know, we sit geographically on a major drug corridor, so you know the drugs flow through here into Canada. I wish I had the answer for that, but I believe that the substance abuse is definitely part of the reason we had such a spike. Now, why it happened so much in 1 month, I honestly couldn't tell you. We're taking a look at that to try to figure that out right now.
Again, I wasn't asking, expecting that you would be on top of that. I was just more curious as to what your take is, on what's happening in the community that causes that.
I think it's the substance abuse really is causing a lot of it. And the cases that we're getting are more severe. Sir.
Legislator Haggard.
Thank you, Mr. Chair. Commissioner, I believe that there's a lot of misinformation about what it takes to be a foster care. I'm wondering, and I believe that your staff goes out and talks to groups. They do, don't they?
Yes.
But with this number that Legislator Burke is referring to, this is just gonna make it worse. Do you have enough people in your department to recruit almost, or people need to be informed better about what it is and what the commitment is, and what the requirements. I've heard people say the most off the wall stuff about what it takes to be a foster care. Do you have anything to?
Yeah, I've actually had, I have a, you know, my grade A supervisor position, we talked about recently, she retired. And I have an interim in there who's doing a great job, who's learning the job. One of the things we discussed is trying to figure out how we can give some additional assistance right now in my home fund. They're out there, they're beating the pavement, they're providing a lot of education. We're trying to find a way to do it better and more efficiently and get the information out there. We may need to, you know, reallocate some staff to that unit from somewhere else if we have to, or come back and look. I might have to come ask you for some more positions and stuff. I don't know how much everybody loves that, but honestly, that's if we do take a lot of that back, as we had talked about from the show, so we're really going to have to address that.
If I may, Mr. Chair, one question. It's actually a statement. If we don't address them, then this number becomes the children's home. They're more reliant, and it's whatever it is.
Mr. Denisha, and then we'll move on to eligibility. Yes, sir.
Sure. Could you tell me, Joe, what's considered permanent housing?
We have a number of different options. Some people have gone into their own apartments. We've actually found, you know, apartments, and we give people a list of landlords that our caseworkers work with them, or work with landlords to actually get them to send this. We have some other people who have gone into call single resident occupancy temporarily until they can get into an apartment. But they're their apartments. It's not like a shelter. It's not a congregate. It's not a hotel. They're actual apartments that these people have, and they can stay there as long as they need to get back on their feet. So we have a couple different options there.
My question was, we've got, obviously here in Canton, we have the two buildings downtown, the Roadside Drive, high rise, we got high rise. We have Wall Lane, all low income, senior housing. Any of these folks integrated into the community of that house?
I actually couldn't say, sir. I can find out for you. I don't know if they've done research for us or not. I know that we've got a large number of different property owners and landlords that work with us.
Sure. And, I guess I'm gonna be the opposite of Mr. Reagan. You know, I probably sound like an ogre. But you know, a lot of these folks, the reason that they're not stable, that don't have a place to go, New York State, in my opinion, has abdicated a lot of their responsibilities. You know, wasn't too long ago, we had Ogdensburg at the state facility in Ogdensburg. We've had state facilities all over, had a very large one in Long Island. And the state, in their wisdom, felt that it was good to attempt to mainstream these people. Well, they've cut them loose. They have no idea how to make a living. They have no idea how to take care of themselves or their children. So this is a problem that the state has said, okay, we've got to do this because it's the right thing to do. And the counties have to pick up the responsibility of doing this. And, you know, it's just, to me, it's just another, and obviously these people need to be cared for. We cannot leave people out in the elements. They need to be fed, they need to be sheltered. But again, it's responsibility. New York State owns a big part of this. And I don't think it's fair that the counties, all the counties should be expected to be the remedy.
Mr. Denisha, I see you there. Ms. Curran, you had your hand up earlier?
So some of this went back to the Homestead Act that they passed in 1999. It made housing have to be open to everybody. So we don't really have just elderly housing anymore. You have to let whoever wants to move in there, move in there. That has destabilized a lot of what we used to have for good elderly housing. And what I mean by that is you would have a group of elderly people that kind of ended up in the local housing in a given community. They all knew each other, their families knew each other, everybody pitched in. They helped a lot to kind of make sure that everybody's parents were doing okay. Now, anybody that wants to be in this housing can move into this housing. There's a lot of domestic issues now because they have abdicated keeping people in the setting where there's mental health services on, site, and mix them in with a bunch of elderly people who are sometimes not able or unable to cope with what's going on in their building, and then they move out. So it's created a lot of instability, and I think that, though the Olmstead Act was very good intentioned, that people not be able to say they can't come live here. There needs to be protection somehow carved out to make sure that elderly people are not taken advantage of. That people who need a little bit of help in the community have a place that they can go where criminals aren't able to take advantage of them. And I think that in the bigger picture of housing, we need to figure out a way to do that, whether we have to get New York State to give us some of that back or the federal government, but a whole lot of what we have going on in housing right now is good intentioned, I will say, laws that have sort of run amok. But the Olmstead Act has been a huge part of that.
Mr. Curran, pardon my ignorance, are you saying Olmstead or homestead?
Olmstead.
OLM.
June 22nd, 1999, it was a Supreme Court decision.
Mr. Reagan.
Actually, Larry and I are in complete agreement. There's absolutely no question that New York State's decisions over the past 50 years to deinstitutionalize the mentally ill. And, it's always struck me how Governor Mario Cuomo, in a brilliant PR move, was able to boot tens and tens of thousands of people with serious mental illnesses out of the psychiatric centers around the state. And then once they were wandering the streets of our communities and our big cities, declare them to be homeless, even though they were serious mentally ill people. And he said, oh, there's all sorts of community-based services. And there weren't. And there weren't. I can remember being at a press conference in Albany with Governor Mario Cuomo. Just goes to show how far back that was. And he was explaining to us how he was talking to an individual who lived underneath a bridge, and how that individual liked living underneath a bridge. And no one amongst my brothers and sisters in the press corps thought to say, well, doesn't this show that they're mentally ill? No, obviously they like living like that. So what we've seen over these years has been an awful lot of these people have been forced out of any level of care, abandoned onto the streets, got mixed up in drugs, and in many, many cases have ended up in the criminal justice system. I think the last time I looked, it was like 60 or 70% of the people in county jails and in state prisons were receiving medications for mental illnesses. Yes, that is a huge problem, but it's happened. And what your agency is doing to cope with this problem that's been foisted upon us by the state and federal government is still praiseworthy. And, you know, we as county government are always the agencies of last resort, the people who, where the rubber meets the road, the folks who actually deliver the services, while everybody in Albany and Washington talks about it. Your people are doing something about it, so thank you.
Sir, I have some really good people. Very grateful and very fortunate to have.
Commissioner, which federal or state grant is funding the homeless services unit? Can you clarify for us? It's a bit of a trick question.
Yeah, it's a bit of a trick question. It's not that simple.
Right.
I know, we're receiving money from, excuse me, for the warming center portion of the RCFS. There's another pot of money coming from the state of New York to cover a lot of our shelter placements. But it depends on the type of shelter placement that we have. If you have somebody who goes in, for example, after hours, we can't get an application done on that, and that's out of our admin fund, and that's on us. If it is something that we can actually process through an application and put it through, then that can be reimbursable through the county. So my goal is to have as many people go to the warming centers as possible during these cold months to reduce the number of people that are getting put in the hotels and cut down on the costs, because we have that there. And, what I was told, and what reality of it may be different, I was told is that we run out of money that we can apply for more. So, but checks it out.
Thank you. And the point of my question, really to point out, it's not like we're responding to this giant homeless services grant that was offered.
Correct.
And we're just following a commission given to us. This is this idea and execution originated locally. And I think the the commendation is warranted for sure. Now, we've also pursued funding for this properly in time.
And we are, I had, Deputy Hamilton did a great job, and he applied for an amended Code Blue budget for us to get more money this year. Because we knew the Code Blue was going to be statewide, much more heavily utilized, in terms of homeless placement. So we were able to get additional funding there, so that we've been doing, I think we're ahead of the game, for November. I'll talk again in December.
Do you have additional statistics to share with us?
Well, yeah, sorry. Yeah, so we covered the eligibility at length last month, so I'll just give you kind of a 1,000-foot view of what's going on here, starting page 7. Really, not a lot has changed month to month. You will see there's been a moderate increase in the number of SNAP cases. Excuse me, we have a total of 13,059 individuals receiving SNAP benefits right now. So the number of cases jumped a little bit from this time last year, but pretty much everything's staying the same. On page 8, again, our applications have popped up a little bit for SNAP, a little bit down for temp assistance, but as we get into the heat months, that's all gonna go back up again. Child care assistance payments again, you can see the drop down from August to October. School started, people won't need, daycare all week long, so, those payments have come down a little bit. But, we're getting a lot of applications with the increase eligibility out there, so, we're gonna be busy there. One thing I would like to mention now, is on the next page, on page 9, Medicaid applications. You can see the big spike there up to 97, community Medicaid and 37 chronic care. The increased eligibility is having a big effect between that and all the recertifications that the state's requiring, because with increased eligibility, we have to go and rebudget every single case. Staff are flat out trying to get this done for people. But I do know that there are a number of individuals because of this, but their payment has gone down because the eligibility's gone up, so their share's gone down. So it's been, for some of the people that are on a fixed income, it's been a positive thing, but I have a lot of staff, and no additional staff to work on it, but they're doubling their workflow, and they've been stepping up to the plate. We're very busy there. And you can see active Medicaid, adults, children together, we got about over 9,700 active Medicaid cases right now. So that's something that's going to keep that unit really busy for the foreseeable future, even though the state's been saying that they want to claw that back for the last, I don't know how many years. So does anybody have any questions on any of those statistics? I apologize for fibbing to you about being brief.
I think the board can take the blame for your lack of brevity today. A lot of triple hit, but. Any other discussion or questions? Okay, we have a resolution authorizing the chair to sign a contract with Heidi Suki, I even wrote it down, Suki, for assistance and additional training in children's services unit of the Department of Social Services. Is there a motion? Mr. Smithers, seconded by Mr. Burke. Commissioner.
Yeah, this, as I mentioned, I have an interim in that position who was previously our grade B on that side of the house for home finding. She's doing a good job, but it's a huge job, and Mrs. Cease held that position for 34 years. There's lots of the job that we really need to get some training for her on. Mrs. Cease has agreed to assist us with that, to kind of help us out. For as long as it takes up to the 90 day, I think it's 90 days, 3 months. 3 months is similar to the contract that we used in our accounting unit a couple years back when Colin left, and to help train and keep us going until we were able to get those positions filled. So it would be a huge boost for us to be able to have that training so we can keep going. So I respectfully ask your position or your permission on this resolution.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Thank you, Commissioner. Oh, go ahead, Rebecca. Next, we have vacancy review.
Yeah.
Well,
One department, several positions. I think we have seen a reduction, as many as one position come through social services in previous few months. But this time it looks as though we're catching back up, seeing and requesting the opportunity to have several filled this evening. So I'll turn it over to Commissioner.
Well, the first position I have is a caseworker, and she was assistant incumbent who'd been in this position resign, so she can go back to school, and take a job in the private sector. This position is on the side of the foster care side of the house, the unit side of the house, and we've talked at length about what these positions do. The caseloads are down, but we are, as I said, going to most likely see an increase in that as we go forward. And as these kids that we're getting on the additional number of CPS reports working way through the system, they're going to be coming up with foster care as well, most likely some of them. So with that in mind, just to stay ahead of the 8 ball on this, I would ask your consideration on this position.
Questions? Okay, next up is clerk and employment.
The individual that we had in this position, I'm happy to say stayed with us, was promoted to a secretary 1 over TH spec. Excuse me. So this clerk position works in the TA SNAP unit. Works with a lot of our cases coming in, working with our employment unit as well, making sure that people are getting the services that they need, and the paperwork is done. Sending invitations to the meetings, and taking the notes, getting our filings done, a lot of the paperwork prepared for the unit. It's a lot. I have 2 keyboards in that unit handling all that paperwork right now. And with this person gone, it's going to fall on 1 person right now. So with that in mind, I would ask your indulgence on this position.
Questions? The clerk? Okay, next up, senior social welfare examiner. And there are 2, so if the board does not object, we'll have their role is in one.
It was kind of an odd situation, kind of a perfect storm. I had 2 retirements, both principals in Medicaid, one in chronic care, one in community care. So they both retired. So I'm sorry, when they retired, we had to fill those positions. So this individual that left this senior social was promoted to fill one of those principal positions. This went to the community Medicaid unit, and they supervise the system supervision of the other examiners in that unit. I just spoke with you regarding the increase in the eligibility and the increase in the recertifications that we have to do on both sides of the house. This position is in the community Medicaid unit. The other one is in the chronic Medicaid unit. They are identical. Both positions are vacated because of people promoting within the unit to those principal positions. We really need to stay ahead of the game with Medicaid. So for both of these, I can get your consideration to fill these positions.
Questions on one or the other of the senior social welfare examiners? Okay, next up is TA SNAP keyboard specialist.
So the keyboard in this unit retired. I did her exit interview today, as a matter of fact. She spoke glowingly about her 34 years in TA SNAP, and how much she enjoyed working for the people of St. Lawrence County and the citizens she was in battle. But again, we have, as I said a minute ago, we have the 2 keyboards and then 1 clerk. So with the keyboard and that clerk position both vacant, I've got 1 clerical person that's going to be really taking a lot of the load right now. As I talked to you a few minutes ago, we have a large number of people coming through TA SNAP. We've got 13,000 individuals in the county who receive the SNAP benefits, and more applications coming in. So this position is important in making sure the paperwork's done and things are moving in the direction we can move, so we can meet our deadlines and not fall behind. With that in mind, I would ask your permission to fill this position.
Questions on the keyboard? Okay. And the last two are, caseworker positions in child protective services. So again, if the board has no objection, you can speak to these both in one summary.
One of these individuals, actually, both of them were promoted to senior caseworkers, so that's why the positions are vacant. As I mentioned, our caseload is jumping to 15, which is the state recommendation. Get that back down. These senior positions that we filled were important, but unfortunately, that created a couple of vacancies here. So I don't really have a whole lot to say more than I really need to get you filled. I think I've already said everything, so I'm asking permission to fill this so we can not continue to. Oops. I don't want to keep this.
Remember, these positions, as they come vacant, neither of these sit in the pool. So the pool positions that Commissioner referenced as they reviewed the summary, these are permitted if the board approves at the board meeting. That allows those pool positions to move into these, and then the pool can be backfilled. So that continues the process the board put in place to get that training, to continue that training, and to continue bringing folks in. And they also fall into that health program that HR has put together and authorized by the state. So it creates an opportunity to continue bringing folks in faster than we have before. Any questions?
Mr. Ray, how are we doing at working with the local colleges to make their career planning and placement offices aware of these kinds of positions so that, you know, we've got some positions that have a bachelor's degree required. And the career planning and placement offices will often let their graduates know, hey, you know, if you're looking for another job, if whatever it was that you did right out of college isn't working out, here's an area that you might want to think about. Are we being proactive about going to the 4 colleges and having them, putting them to work, helping us get the kind of qualified people that we need in the county government?
So I think a couple, certainly if the commissioner has more specific information for the department. I know that both human resources and most recently public health are getting involved with the virtual job fairs as well as the in-person job fairs to make those positions available to folks to come in and have a live person available to talk to them about what these roles look like. I'm not sure if social services has engaged yet.
And then we have also to the career, excuse me, the career offices of the colleges, we've sent out copies of the ads for the caseworker and welfare examiners, because those are the ones that are most frequently vacant. With the information that we are continuously recruiting for those, and to kind of direct people in this direction and you know, let people know that that's a valid career path for them as well. Thank you.
Getting there, not there yet, but getting there. Any other questions on vacancy? Okay, you could just give us a minute. We'll get set up for the next item.
Yes.
Okay. Come on. And bringing up the slide presentation, I can confirm for you that last week I took the opportunity at our first committee meeting following the presentation of the budget to go over in more detail what that looks like and give you additional information. And then I spent what I had planned on, more like 5 slides, on the departments that report to operations. And so for this week, that will be what I do. There's a very short summary. Next week, I will finish, so that'll bring us up to about 35 slides. By the end of finance, we'll probably be around 50. So want to tie it all together. Certainly under finance, I'll bring in some of the other components of wrapping up, you know, probably if the board moves along with the schedule we have in place. be the final opportunity to ask questions before the board takes the public hearing and adoption consideration on the 4th. So that being said, this is the Services Committee tentative budget review. And the departments, next slide. The departments that report, there are 7. Now they combine for 387 staff, so they're about a third of our staff that report under these, certainly our largest department, being social services, community services, public health. Then you've got Office for the Aging, and then you've got our departments of pairs, which is Youth Bureau, Veterans, and Weights and Measures. So a large swath of, from the largest to the smallest in county government, report to services. But they combine for 101.9 million in our appropriations. Of that, 297 that you're considering. Next slide. And the breakdown of those is, like I brought to you last week, the number of staff between departments, the total appropriations. So I'm giving you the picture. The balance is the revenue, with the difference being in that county cost. The total appropriations of these budgets. Set aside that net county cost and the breakdown of how much that department's cost is related to the levy. So when you look at community services, they are, and I'll go into a little bit more detail in a moment, just under 2% of the overall levy cost. However, they have a total appropriation of 10.9 million. Social services is 74% of our levy. They have a $77.3 million budget, of which just about half, 40 million, is a total county cost associated with social services. So when we look at this, and we look at the services departments in front of you tonight, they represent 44% of our staff. They represent 34% of our appropriations. And overall, they're just over that third, 29% of our departments report to this committee. So when you look at the smaller departments, they're all under, except for the Youth Bureau with some revenue changes this year, they're all under that $200,000 mark and 0.2% of your levy. All valuable services we provide that report to this committee. Next slide. So as I mentioned, social services being 74% of your levy. When you look at the change this year, so they're 14.3% or 14.3 million in personnel costs. But that's only a change of 161,000 over this year. So what we looked at in social services was some changes that the department requested during budget, some position changes. But we also looked at positions that had been vacant for more than 6 months. And we ended up taking 7 of those. Because if positions are sitting, the balance of those positions, while some are 100%, some are not. And if they're sitting vacant, we looked at pulling those for this year because they've been sitting vacant. If existing lists occur and positions need to be filled, our expectation is that departments take it seriously and they fill those positions. When you don't see a change in the overall caseload impact with positions vacant, well, it makes you wonder if those positions should remain. And what I also indicated to Commissioner when we talked this over was the balance of the equation is where there is a need, where programs change and needs emerge. The board's been very gracious about looking at those at vacancy review and adding positions where it makes sense. You added 20 positions to this department in 1 year. When we talk a little bit later about how we're no longer at 789 positions and we're up over well close to 900, you added 20 positions in 1 year and have continued to do so, looking also at letting positions be abolished when it's appropriate. So in this department, our equipment was just $200,000 this coming year requested. The increase in the contractual amount, which is all the services that are paid for, Medicaid included, we're looking at a $3.1 million increase in the whole department of $77 million. 2 million of that is Medicaid. So when you think about the ebb and flow of services on all levels that Commissioner just reviewed, from eligibility on to temporary assistance, safety net, everything that ends up coming back to us, that's pretty remarkable to see only $1 million, $1.1 million increase in a very difficult year on the economy. And then you see there actually is a decrease. We talked about that at the first presentation in health insurance, a modest decrease of that 28,000 under benefits. So the overall appropriation is 77.3, which is remarkable when you consider, even though it's 75% of our levy, All of those dollars are flowing into the county. And we're asking as a part of that for $40 million of your $54 million budget for social services. The 3-year variance in the overall cost, because we talked about that last time when we talked about relativity of the appropriations over time, is 4%. Now, what we also recognize, and you granted permission on the children's services side to look at a contract. You'll remember a couple of years ago, we had a contract when our fiscal person moved away. We now have someone in place, but we've gone the better part of 2 years without someone. And so when Karen and I were taking a look at 21 and 22's revenue and the overall net county cost for those years, we're farther ahead than we've been in other years. And there may be a need to have some revenue reconciliation. And when I say ahead, to the tune over 2 years of $7 million in a $77 million operation. So we may bring you an adjustment to that revenue once all of these reports can be reviewed, once someone who knows what they're looking at is in place, and they can marshal the efforts of all the accounting staff much better than we've had before. Because if you remember, last budget, you adopted, it also added an assistant accounting supervisor. So now there's a lead and there's a backup for the lead in that fiscal unit. And for a long time, there wasn't. We had a 9-person unit that if the head either left or was out on leave, we were at a big gap because all of those folks are very specialized in the disciplines they understand. So you granted the ability for us to improve the stability of our fiscal unit, but that may also, as they get into place, require you to make some adjustments. But that $2 million Medicaid increase, I don't want you to forget, because that's also bolstered the discussion, the continued discussion of the override. And I know that's not an easy discussion to have, but I think it's important to remember. Next slide. We have 2% of the levy in community services. I just wanted to highlight for you, we spent quite a bit of time, which I was grateful for, with our Deputy Director Best, in our personnel costs of just over $3 million. Our contractual items, remember that's the local government unit, so not a lot, all of that is county cost. That is reconciled dollars from either state or federal government through to the agencies in the county at the local government unit. The total appropriations is just under $11 million with a 1.04 county cost. Next slide. So I wanted to return to, because I've heard a little bit more on this 17.86 number, this FTE increase. So we went back and took a look at the increase from the days in 2018, probably when we hit the low that I recall, or in my time here, at 789. We also in that time had reduced services. We also in that time were increasing or growing any services because we had no funding or ability to do so. We had taken on Jefferson County Children's Home, for example, to look at recruiting for us because we didn't have the forces to do it, to then also manage the foster care environment because we didn't, again, have staff to do it. So when those numbers were in that area, those were the things we weren't doing, and instead we're paying for it to be done. Now we're looking at those increases, and overall, the board's action in the year's time, which means you adopt a budget, let's assume December. Since we stopped inputting positions, you've had board meetings and made changes to positions. Those aren't included here, but they will be once you adopt the budget. So as time goes, and then January on through to now, the board's actions have added 19.87 positions total net. The budget team action total is a decrease of 2.01 positions. So that 17.8 is the entire change since you adopted the budget at the end of last year. But we also took measures like addressing the elections challenges with wage changes. We've adjusted 2 positions to be part-time to full-time, from election clerks to data management technicians. So some of those changes, we've also included an additional building maintenance worker a year after our superintendent's been on the ground to take a look and see where there are gaps in service. We've also included a network technician. I talked a little bit about that related to security, both for cameras and swipe access. As we're endeavoring on a major project, we feel having 1 point person instead of at the department level is going to be much better for the county organization to understand where our resources are and how we manage them as it relates to security. We've also added that office manager position and a fiscal officer we added in public health. Long have we stood with 1 administrative person, not unlike in social services. And we looked at it and thought, when we have gaps, and we do, in the service of those individuals, who's taking over? There's account clerks, but the numbers both between COVID grants and specialty grants and programs associated with public health have grown 3 times in the last 5 years. So we looked at this and said, we still need the fiscal officer position that we have there, there's a different title for it, and we're adding a fiscal officer, so they will report directly. But not unlike what we did in the county clerk's office. We added a fiscal position because they've never had one. This will subdivide that work because having all those grant funds, they need to be reconciled, they need to be collected. That's where the revenue is for the county. So those are some of the personnel actions that total up to not only the actions of the vacancy review committee, but looking at the net change overall with what we've encouraged departments to say, which is, I can go without this position. And in fact, the DA gave up a clerk position, but he needs another attorney. And we were able to make those adjustments and bring those to you as a full package. We also looked this year, as I mentioned in board of elections, at increasing the wages. And we looked at the board's action earlier this year to increase the office for the aging and the assistant title from a grade 7 to a grade 13. And so we've also taken a look at what we're able to do for the unrepresented staff. And we're taking a look at moving those forward by 1 grade so that their recognition or their service can be recognized in 2024. But I've also added in contingency, as some legislators have asked about, funds to be set aside. We'll negotiate not 3, is mistaken, 4 contracts next year. CSEA Solid Waste, Indigent Defenders, and Council 82. So I want to talk about on the other side of budget adoption, if possible, to set aside funds in a reserve for those negotiations that are coming up. Next slide. And so next week, we will go through the last of the departments. We will go through the county administrator's office, and I'll do a detailed accounting of what's in contingency and what's in capital reserve. County attorney's office, which you'll remember is also our self-insurance. Highway, which is road machinery and road fund. Real property, our solid waste enterprise fund. The treasurer's office, and then I'll do an overview of our partner agencies. Questions?
I'm kind of scratching my head a little bit. I'm DSS.
Okay.
Because it's 75% of the tax levy.
Yes.
Approximately. And when we look at the positions, when we're doing the hiring, like we did tonight, it was, I don't know how many, 6, 7 positions, but a lot of the cost of those positions is reimbursed, like 65% or so. So it just seems strange, and I'd have to dig into the details of it, or maybe you could just explain a little bit. Why is it that despite the fact that so much of the cost of the positions is reimbursed, it still makes up such a large percent of the tax levy funded by the county?
So the appropriations that you're seeing that total up to that 77 million is mostly services. As I was talking to you earlier, I scroll back up to that social services slide, please. When you look at it, only 14 million of those, of that 77 million, is people. So, and you parse that out and say, okay, our Medicaid staff, I couldn't give you exact numbers, but I could certainly get them for you. They're 100% staff. So of course, that's no cost to the county for fringe or for their salary. But in some positions, they are reimbursed either 60%, 70%. So the balance of all of those positions of the 257, those total up to that 14.3 against the revenue that's coming in. So they account for the revenue. So the balance that's left in of that 14.3 million is a variety of the percentages of each one. So that's not really where your spend is. Your 55 million in services, whether it's institutional care, whether it's foster care, whether it's eligibility and safety net, that's where your funding is. That's where the big dollars travel through. And Medicaid is the third of that, or almost half.
Okay.
Okay.
Ms. Reagan?
Need to be flipped, but when you're looking at positions and how much the state and federal government fund them, I think you'll often find that those positions that we as the county legislature would be least likely to fund ourselves, those are the positions that the state and federal government are contributing the most to, while the things that we would most like them to fund, that we want, they don't fund. So, you know, sheriff's deputies, we get to pay the whole 100%. Correctional officers, we get to pay the whole 100%. The things like, you know, so often when you see a position that's 100% funded by the feds, it's something that, you know, you wouldn't be running to appropriate.
And just as a round total, I didn't have the Medicaid number in front of me. Of that 55 million, the Medicaid payment is 42%. That's a large share. Any other questions? And we are, I just wanted to mention, going to finish up those summaries that you're used to receiving, that kind of give you that overall what's changed in this department year to year, that we also fold into the ClearGov once the budget's adopted. And we should have those ready for you for next week.
Thank you. Other questions on budget review? Moment? Right, next we have committee reports. We'll start with Board of Health. Legislator Curran.
Thank you. The October meeting, I think we talked about before, we do not have a November meeting. Our next meeting will be December 19th. And when they publish the minutes for October, which they probably won't usually do December, I will forward them to everybody. But it's the basic review of how many lead patients we're following. All that, but there's specific numbers you can look at, okay?
Any questions? Okay. Next, we have the CDP Board of Directors. Legislator Burke.
CDP, big focus for CDP has been trying to, to that end, they've had advertisements. Channel 7. It's been a real challenge trying to get up. The state is holding CDP's fields to fire. Either at or capacity by the end of the year. So again, it's a challenge, and staffing is also a challenge. Vacancies are extremely hard to fill. That's on the Head Start end of things. On neighborhood centers, there was a fundraiser for the Canton Neighborhood Center, spaghetti dinner. So they're trying their best to make it. It is a challenge. But
Thank you, sir. Next, we have Community Services.
Thank you, Mr. Chair. We met on November 7th. I gave a brief legislative liaison update, which came conversation about downstream providers receiving funding. And we're still in the midst of having that discussion. That's something. North Country Freedom Home, Citizens Advocate, Board of Mobile Clinic. The next meeting is on December 13th.
Thank you. Office for the Aging Advisory Board.
Mr. Chair, Office for the Aging Advisory Board met on Monday, November 6th. Actually, Andrea covered quite a bit of what we discussed at the meeting. But I want to reiterate the advocacy letter that was sent to all the legislators from the Association on the Aging to Governor Hochul's office. Hopefully every legislator can fill that out and send it in. And the other thing I want to, again, bring to everyone's attention. I know everyone got a flyer in the mailbox, the Office for the Aging is the holiday gift drive. Again, you'll hear me the meeting until so Christmas gets here. If you haven't dug into your wallets, your checkbooks yet, please do. It's the 10th annual holiday gift drive for older adults in St. Lawrence County. I can tell you from experience, the folks that receive the baskets, the gift cards, things, it's something that they really appreciate. And most of these folks are in a situation where they really need something extra. So please give whatever you're able to give. And you can either take it to the Office of the Aging, that's the before, I'm sure. Thank you. Oh, our next meeting is Monday, February 12th.
Thank you, sir. Legislator Tominelli is absent tonight, but has she deputized anyone to report from Youth Advisory Board? So we'll skip that for now. Next, is there any old business? All right, we do have a resolution that was tabled to this meeting. So I'll read the title and see if there is a motion to remove it from the table. The resolution is urging Governor Hochul and the state legislature to allow speech language pathologist assistants and aides to practice the license registration or certification in the state of New York. In the New York State Early Intervention Program to expand capacity for children in need of services in rural areas of New York State. Is there a motion to remove this resolution from the table? Ms. Haggard, seconded by Mr. Reagan. So it's back on the floor. Is all in favor of removing the resolution from the table? Any opposed? Discussion, Legislator Haggard.
I'd like to make a motion to withdraw this resolution after further investigation and speaking. I think there's some things to be tweaked, and it's a little bit more than something we would do on the floor, so.
Okay, I believe the motion to table, or the original motion to table, you know, Kelly, who seconded the original motion to table? The original motion to consider the resolution.
Yes.
Okay, so, we have to make sure that the legislators who motioned and seconded to consider this resolution are in favor of the motion to withdraw. So the resolution was originally motioned by Legislator Lightfoot, seconded by Legislator Smithers, Jeanette, Venetia, and Curran. And so we would have to have seconds from all of those legislators for the motion to withdraw to be considered. How's that work?
Agree.
Okay, so motion to withdraw seconded. Any discussion on the motion to withdraw the resolution? Hearing none, all in favor of withdrawing?
Aye.
Any opposed? The resolution is withdrawn. Thank you.
If I may,
Legislator Hackett, yes.
Legislator Trump sent me one text.
Oh, sure, go for it. Yes, you used to advisory board.
Okay,
Yep.
but just one thing, she said, fourth annual holiday. And you send those to the youth bureau. Thank you.
Noted. Thank you. Is there any new business? Mr. Forsyth.
Thank you, Mr. Chair. I just want to give a thank you to the county administrator, the highway superintendent, Mr. Rover, for the road tour we had last Thursday. Very impressive. We got to see two of the bridges, or three of the bridges, two we did walk by, and get to look in the brooks that they went over. And just to see what the highway department does and all the work that they accomplished, and kudos to all the staff. The bridges were completed by our highways crew, and very impressive, I thought. So I enjoyed it, and it was nice to see them back. So, and then Friday, one of us had the opportunity to learned about crypto mining in Messina. And that too was impressive. I didn't realize how much electricity they actually use, but it is incredible. There was one room there, probably a couple 100 feet long, 10 feet wide. They used more power than all the municipal electric in Messina by 2. You know, one little room, well, one big room, but it's incredible. But I learned quite a bit about crypto mining. I learned that they do generate sales tax to this county to the tune of our shares around $2.5 million. And they employ 80 people there on average, and pretty good salaries with nice benefit package. So thanks for doing that. Patrick Kelly lined that up, and I enjoyed it, and I think everyone else learned something from it. So, and they've got some other irons in the fire too. So I just want to say thanks to all.
Any other new business? Hearing none, is there any to enter executive session tonight?
There is for litigation, negotiations, personnel, which is the medical, financial, credit, or employment history of a particular person or corporation, matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. And there is one appointment.
Is there a motion? Mr. Forsythe, seconded by legislator Haggard, and Consider Lightfoot.
That's for us. We have to reopen everything for everybody. Okay. Also, if we're preparing for that,
Yeah.
we're back online.
Motion to adjourn.